The second acid-base reaction conventional cement that we are discussing is zinc polycarboxylate or zinc polyacrylate cement. We have to describe the composition, chemistry, manipulation, and properties of these type of cement. The zinc polycarboxylate cement applied for cementation of cast restoration, cementation of orthodontic brackets. It is used also as bases and liners under other restorations, and used also as a temporary restoration. There is here a new use, which is a liner under other restoration or metallic restoration. So the zinc polycarboxylate cement can be used as a liner. That means that can be used in cavities near to the pulp. In other way, it doesn't cause pulp irritation. It is presented as a powder, and liquid, together with paper pad. The paper pad is preferred for the mixing of zinc polycarboxylate cement over the glass slab because it is sticky, so it can be easy to discard the paper which we mixed over it. The second type of zinc polycarboxylate cement is anhydrous type or water-soluble type. This means that it is mixed with a distilled water. So it is supplied in the form of one bottle containing the powder, both the powder and the liquid. The liquid in the form of powder. They take the liquid acid, freeze dry it, and transform it in the form of powder and to be added to the original powder of the polycarboxylate cement, and when we use it, we mix it with a distilled water. When mixed with a distilled water, the acid will transform into the liquid form and the reaction begins normally. It is mainly used for luting indirect restoration because this keeps longer working time and keep the acid in its form. The composition of polycarboxylate cement, the powder composed of zinc oxide, the main composition, magnesium oxide, silicon oxide, bismuth oxide. This is the same as that of zinc phosphate cement, in addition to a small amount of stainless fluoride. And the stainless fluoride here, its function is to increase the strength of the set cement and modify the setting time and enhance manipulation. It is not added for the fluoride release. This amount is very small and cannot do anything with the fluoride protection to the tooth structure. The liquid composition is about 32 to 40% polyacrylic acid. This means that the water is added to the polyacrylic acid, as it is a water-based cement. The polyacrylic acid is a polymer chain. This is the backbone or the polymer chain. Pendant or suspended from it carboxyl groups. And this is the main reactant with the powder. In addition to itaconic acid prevents gelation on standing. Because as we store it in the clinic, the itaconic acid prevents the thickening of the liquid and we cannot use it anymore. The tartaric acid added to modify the working and setting time, in addition to the water in the liquid. The reaction of polycarboxylate cements begins when the basic zinc oxide powder contact the acidic polyacrylic acid liquid. Ionization of the liquid occur and release of the zinc ions from the surface of each particle occur. Then the reaction begins with combination or reaction of zinc ions, which is divalent, to two carboxyl group, forming the polyacrylate zinc polyacrylate gel, which is the main matrix of the cement. Embedded in it, the residual unreacted zinc oxide powder. And the gel matrix is a weak matrix, and also the polyacrylic acid can react to the calcium of the tooth structure the same way through the carboxyl group. And this is a scanning electron microscopic photo of the set polycarboxylate cement. This is the amorphous gel matrix of zinc polyacrylate, which is the white portion of the slide. Embedded in it, the unreacted particles of the zinc oxide. The mixing procedure of polycarboxylate cement is done over a glass slab with stainless steel spatula, or better, over a paper pad and plastic spatula. Why? Because the acid, the polyacrylic acid, is reactive to the other surfaces like the stainless steel spatula or the glass slab, so the cleaning will be very difficult. We dispense the powder and the liquid. We dispense the powder over one side of the glass slab, and nearby we dispense the liquid. Then we divide the liquid into two portions, one large portion, about 90% of the powder, and the rest 10% to adjust the consistency. The mixing begins with the addition of the 90% of the powder all at once to the whole liquid and mix it over a small area of the glass slab with a rotatory movement in one direction. Why we add all the powder to why we add the 90% of the powder to the whole liquid? Because the formed matrix is a gel matrix and it is a weak matrix. This is to prevent destruction of the gel matrix when it is formed. And we have to bear in mind that this type of cement cannot the working time cannot be extended by division of the powder into small increments like the zinc phosphate cement, also to prevent the destruction of the gel matrix. And the reaction here is very rapid, and we cannot extend the working time by cooling the glass slab or cooling the spatula. Why? Because this will help thickening of the cement liquid and will give inferior properties. How can we extend the working time with the polycarboxylate cement? not by cooling the glass slab, but by cooling the powder, only cooling the powder of the material, not the liquid, because if we cool the liquid, it will thicken and give difficult mixing and inferior properties. The consistency, the working time is about 2.5 minutes with the mixing time of 30 seconds. And here we notice that the working time is too much lower than that of the zinc phosphate cement. So the zinc phosphate cement has an advantage of long working time and reasonable setting time, but with polycarboxylate cement the working time is very short and also the setting time is much less than that of zinc phosphate. When we see the viscosity, the proper mix zinc polycarboxylate cement appears more viscous than that of the zinc phosphate cement. But it is a proper mix. To reduce this viscosity, to obtain lower film thickness, we have to apply shear stress during mixing. How we can apply shear stress? We apply shear stress by spreading the mixed cement between and squeeze it between the glass slab or the paper pad and the spatula, as if we squeeze them in one direction. And this will give a reduced viscosity of the cement, which is almost comparable to that of the zinc phosphate. The initial viscosity is compared to the zinc phosphate cement, as we said, because of shear stresses applied during mixing. And the viscosity can be decreased by pressure to give a low film thickness of 25 seconds. This is the zinc phosphate cement and this is the polycarboxylate cement. The proper viscosity for cementation for the polycarboxylate cements can be tested by drawing the spatula. The cement will draw with the spatula for about an inch and then draw back under its own weight. And the viscosity is increased by time. If we leave the mix before we apply it to the oral cavity, it can be thickened and there is a threads appear here. Why? Because the liquid is a polymer acid, and during setting it passes through the steps of polymerization which give this appearance. And when we use this, it cannot give proper cementation and we have to discard the mix and make another new one. To cement a crown, we have to fill the inner surface of the crown with the mixed cement and put some of the cement over the tooth structure and then push the filled crown with cement over the tooth structure, and we have to see the excess cement over the margin of the restoration. This means that the cement properly wet and cover the tooth structure and the inner surface of the crown. So when we can remove this excess cement before it has completely set or after complete setting. After complete setting is a better method for this type of cement to remove the excess. Why? Because during setting it passes through a stage of threading, and if we remove the excess cement before it is completely set, it may pull out some of the cement from underneath the crown, making a poor cementation and reduce longevity of the restoration inside the oral cavity. So it is better to remove it after complete setting with sharp instrument. So the clinical consideration with the use of polycarboxylate cement is to apply shear stresses during spatulation and apply vibration during insertion of the restoration. During insertion of the restoration, we can make some vibration to seat the crown, and this helps to reduce the viscosity more. So let's go to the properties of the polycarboxylate cement. Bonding of this cement to the tooth structure. It makes a chemical bond or adhesion to the calcium of enamel and dentin. Chemical bond, it is ionic bond, which is strong chemical bond. The adhesion to the tooth structure depends on the unreacted carboxyl group, because the adhesion occurs between the carboxyl group of the liquid with the calcium of the tooth structure. So to be sure that we have enough unreacted carboxyl group in the mix, we have to apply the cement while shiny or before it loses its gloss, because a glossy appearance of the cement means that there is liquid inside the mix not reacted with the zinc ions from the powder. When we have a plenty of unreacted carboxyl group, it will make a good bond to the tooth structure through its reaction with the calcium ions in the tooth structure. And to have a good bond to the tooth structure, we have to apply it over a clean, dry tooth. The cleaning of the tooth surface occurs with the application of 10% polyacrylic acid. The polyacrylic acid removes the smear layer. What's a smear layer? A smear layer, it is a layer of debris and dentine powder occurred after preparation of the tooth, and this layer covering the surface of the tooth structure, so there will be no calcium for the cement to bond to the tooth structure. So we have to remove this layer. This is the layer, the smear layer in the first slide, and this is after removal of the smear layer with 10% polyacrylic acid, exposing the dentine, and this is the orifices of the dentinal tubule. This is a transverse section of the tooth. We have to bear in mind that this process called conditioning of the dentine. It's not acid etching, because acid etching removes the calcium of the tooth structure, but conditioning is a process with less delicate, remove only the debris of the dentine. So acid etching here is contraindicated. We have to use weak acid to condition the dentine or to remove the debris of the smear layer from the surface of the dentine, and this is done by 10% polyacrylic acid. What about bonding of polycarboxylate cement to the restoration? First of all, polycarboxylate cements bond chemically to the non-precious or base metal alloys like stainless steel and nickel chrome or cobalt chromium and so on. These all non-precious or base metal alloys. Why? it's easy to bond to these type of metals because they have an active surface. When we have an active surface, it is easily uh, react with the polycarboxylic acid, forming a good bond, good chemical bond. But when we have a gold crown like this, it cannot be bond to the gold. Why? Because the gold is um, inactive in its surface. So it bonds mechanically bond to the gold and its alloy. To increase mechanical bonding, we must make a roughening inner surface of the crown to increase the bonding between this type of cement and the gold restoration. The roughening occur using sandblasting or electro-etching. Can polycarboxylate cement bond chemical to the gold alloy? Yes, simply by tin plating the inner surface of the crown with non-precious or base metal alloy, which is tin, and this transfer the inactive gold surface to active surface, which can chemically bond to the gold alloy. This cement soluble inside the organic oral fluids. Yes, it can soluble inside the oral fluid, uh, but the solubility is less than that of zinc phosphate cement because of the nature of the liquid. The solubility increased by the reduction in powder liquid ratio. So the powder liquid ratio is very important to reduce the solubility and give better mechanical properties. The mechanical properties of polycarboxylate cement is considered high enough to be used as a eluting agent or a base under other restoration, but compared to the zinc phosphate cement, it has lower compressive strength and lower modulus of elasticity, but it has higher tensile strength, but this cement is still a brittle one. The use of polyacrylic acid as a polymer acid for this type of cement make it more resilient than that of the zinc phosphate. Let's go to the biological properties, which is the main property of this type of cement. It is compatible to the pulp. It has a blend effect, or it doesn't cause irritation to the pulp. Why? Because when the powder and the liquid are mixed together, it rapidly neutralized. It has a large molecule because it is a polymer molecule, so it is difficult to pass through the dentinal tubule because the size of the polymer is larger than the orifices of the dentinal tubule. That's why it cannot be passed through it, and that's why it is bland to the pulp. Also, it has an immediate bonding to the tooth structure. All these are reasons why it is compatible, although the pH of the liquid inside the bottle is higher than that of the zinc phosphate. So this makes us use it in a deep cavity. We can use this type of cement because it is not irritant to the pulp, and that's why it is used as a liner. It's used as a liner because of its biological compatibility to the dental pulp. But if we have a cavity very near to the dental pulp, means it's microns of dentine present between the base of the cavity and the dental pulp, we have to use a protective layer or a liner of other materials like calcium hydroxide to protect the pulp from the irritation, because in this situation we consider it as a direct contact between the cement and the pulp, because the dentinal tubule is very thin and the cement almost contacting the pulp directly. And this is a slide showing a deep cavity in which we put a liner of calcium hydroxide over the deep part of the cavity. But we have to put the liner only over the deepest part of the cavity, leaving the floor, the rest of the floor without calcium hydroxide. Why? To allow this type of cement to bond to the dentine. As we put the calcium hydroxide over the whole floor of the cavity, it will bond to the calcium hydroxide, not bonding to the dentine. So we omit the property of bonding. So, in conclusion, the advantage of the zinc polycarboxylate cement is low pulp irritation, adhesion to the tooth structure or chemical bond to the calcium of the tooth structure. It is easily manipulated. It has high tensile strength compared to the zinc phosphate, low solubility, low film thickness. But the disadvantages is we have to accurately proportioning this type of cement, because any change in powder liquid ratio will change the properties. A short working time, which is great disadvantage, lower compressive strength compared to the zinc phosphate cement, and it has greater viscosity compared to the zinc phosphate cement, but this can be controlled during mixing and during insertion of the restoration. Thank you.